If you are going to be having an elective orthopedic surgery and you're wondering what kind of things you need to know before, during, after your procedure, I'm going to go ahead and answer all that for you. I am Dr. Brad Homan. I'm a board certified orthopedic surgeon, and I have done thousands of surgeries. So I'm going to kind of answer the most asked questions about procedures as far as what needs to be done before, during, and after. So if you like this kind of content, please like and subscribe to the channel. So let's go ahead and dive in. So about a week before your procedure, you need to start thinking about what medications and supplements that you should stop to get those out of your system prior to the surgery. And the first ones would be the GLP medications like Wegovy, Zepbound, Ozempic. Those medicines are known to slow down your stomach and gut motility, and those need to be out of your system prior to the surgery, and they take about a week or so to clear. So those need to be stopped 7 days before your procedure. 5 days before the surgery, you need to stop all anticoagulants, and that would be medicine like aspirin, Eliquis, Xarelto. These are blood thinners, and they generally take about 5 days to get out of your system. You don't want to have blood thinners in your system for an orthopedic surgery because that's going to increase your risk of bleeding either during the procedure or after the surgery, and that could be a major problem. So the other things to think about would be supplements, because many supplements can also be anticoagulants, and so people don't think of the supplements quite as much, but fish oil is a big one that needs to be stopped. Vitamin E also is an anticoagulant. Supplements like turmeric, and then we've got the G's, garlic, ginseng, ginkgo, and ginger. These are all supplements that could potentially cause excessive bleeding. Sidebar, fun fact, my last arthroscopic surgery was an elbow arthroscopy surgery, and I forgot to stop my fish oil. And boy, did I regret that, because after my procedure, my entire arm was bruised and swollen. So that was a lesson learned. I should have known better, but hopefully if you're watching this video, then you won't make the same mistake that I made. So the night before, what do you have to worry about at that point? That's going to be what you should not eat or drink. So traditionally, people have said, don't eat or drink anything past midnight. The real rules, the updated rules are no solid foods 8 hours prior to your procedure. So if you know when your procedure is, you can kind of make that judge, but no solid foods from 8 hours on to your procedure. You can take clear liquids up to 2 hours prior to your surgery, and clear liquids are going to include things like water or juices like cranberry juice that you can see through, nothing with pulp. Black coffee also falls into this category, but don't put any creamer in there. So straight black coffee is a clear liquid. Electrolyte drinks like Gatorade, Powerade, those can also be drank up to 2 hours prior to your surgery, and then no more after that. So other thing would be, what kind of medications are you supposed to take? If you have a host of daily medications, what should you do with that? And the answer is most of your normal medications you will not take the morning prior to your procedure. The exception is blood pressure medicine. So blood pressure medicine can be taken with a sip of water before the surgery. Most of your other medications should not be taken. If you have specific questions about that, you can consult with your doctor, and you may have, exception to that rule. But in general, blood pressure medicine is the only medicine you take with a sip of water the morning of your procedure. So how about also day of the procedure? It's important for you to have a ride. It's important for you to have someone that's going to be there with you, because a lot of surgery centers won't allow you to do a taxi or an Uber. So you have to have someone that's going to bring you, stay there with you, and then be able to take you home. So check with the surgery center and see if you don't have someone with you, if you can do an Uber or ride share, but most of the time you need to have somebody with you the whole time. So how about after your procedure? Now what? Well, when you get home, you want to make sure that everything is set up for you so that you're not going to injure yourself. So the most important thing is, after a lower extremity surgery, then you're probably a fall risk. Think about it. You're going to be using crutches or a walker. You've got anesthesia on board. After that, you're going to be taking potentially narcotic medications or other medications that can make you a little bit woozy. So you are at risk of falling. And if you have a fall after a lower extremity orthopedic surgery, that could be a problem. So the most important thing is, make sure your floors are clear. And that includes rugs and things like that you can trip over. Dog toys, whatever, get those out of the way. Also, if you have animals that might knock you over, make sure to keep those animals at bay. Another tip is if you happen to have a bedroom upstairs, try and bring stuff downstairs so that you can potentially just crash downstairs for a few nights and days, and that'll make it a little bit easier if you've had a lower extremity surgery so that you don't have to keep walking up and down stairs. That could potentially cause a lot of discomfort for you. The most important thing is follow your surgeon's instructions. So post-op instructions are formulated for whatever the surgery is to make sure to protect the surgery. If you had a repair or whatever, they put restrictions. We put restrictions on our patients to make sure that they don't damage anything. So don't deviate from your doctor's instructions. Those things are there for a reason. So again, I am Dr. Brad Homan, board certified orthopedic surgeon. If you found this content useful, please like and subscribe. The most important thing I would tell you also, if you're nervous about your surgery, is just relax. These things are extremely common. The teams that take care of you are skilled at what they do. Are your surgeon skilled at what he or she does? You have nothing to worry about. Adverse events after elective orthopedic surgery are exceedingly rare. So just try and relax. If you're up all night nervous before your procedure, the good news is once that propofol starts, you'll catch up on your sleep.